Starting?
Good afternoon, everyone. My name is Danny. I'm a consultant here at 305 Plastic Surgery, as you guys may already know. And today we have a very special guest with us, Dr. Nasrati.
Hello, everyone. Thank you, Danny, for having me. Excited to be part of this live.
I'm excited. I think it's the first time, it is the first time we ever meet and that we talk to each other and that we're here. So these lives, actually, a lot of patients interact with us. They love having doctors here, so it's a pleasure to have you here today.
Thank you so much.
And you're mostly known for a specific procedure. Everyone looks for it, Dr. Nasrati, for a BBL.
Yeah.
Is that your favorite procedure?
It's probably the one I definitely do the most of here. Patients love it. It has a big transformation. It's doing two things at once. You're not wasting anything, so you're taking stuff that you wouldn't want and you're putting it in a place you do want it. So it's a very efficient and economical surgery, but it also gives beautiful results.
Awesome. And what would be your ideal BMI for a lipo BBL, for example?
I think the best BMIs are usually in the upper normal to mid overweight range. So, the BMI is under 25 is considered normal, 25 to 30 is considered overweight. And so around 23 to about 28, 29 usually has the best results, because then I can usually remove all of the fat. I don't hit that 4-liter limit. And there's enough fat to really shape the butt and give a nice result.
Awesome. We have a lot of second-round patients that either are your own patients or have come from other doctors. How do you feel about second rounds of lipo or lipo BBL?
Sure. So if you're in that BMI range that I just talked about, you got to be a little bit more realistic with what you want in the second round, because you won't have as much fat. Because like I said, usually most of the fat's removed in the first round. If you're a higher BMI, like 33, 34 and up, then there's probably enough fat for the second round. But usually you need to be a little bit more realistic about what results can be achieved with the second round. If you're a lower BMI, you're going to be focused more on shaping. If you're a higher BMI, you could probably want to go bigger. And then you also need to be honest with yourself about how much fat you actually have. And maybe sometimes you need to add extra areas, especially lower BMI patients. Most often I recommend they add the inner thighs first, because it's going to have the most fat, followed by the axillary area. This area usually has the second most fat. Patients usually want to add arm and chin, which is fine, but it doesn't give me a lot of fat. The chin has like a shot glass worth of fat, and the arms are like maybe 100 cc's, like 3 shots. There's not a lot of fat in those areas.
So ideally, if we want to collect a little more fat from other areas, it would definitely be the inner thigh and the axillary area.
Yep, inner thigh would definitely be number one. That can sometimes give me a liter, 1,000, even sometimes more than that, depending on how big those inner thighs are. And because it's just the inner thighs, it doesn't really affect the shape of the thigh. A lot of patients are worried that if I do the inner thighs, their thighs are going to look skinny. But I don't touch the outside or the front of the thighs. It's just the inner. The only thing that could happen is you might end up with a thigh gap. And if patients don't want the thigh gap, if you don't do any compression there, which is usually what you don't want to do after liposuction, but if you don't do any compression, don't do any massages, you'll get fibrosis build up, and then that area will just stay thick. It'll just be scar tissue instead of fat.
Perfect. Now, I do have a question, because me as a consultant, I get a lot of the patients that are, initial call and they want a consultation and things like that. So a lot of the times, a lot of patients have already had previous lipos and lipo BBLs.
Sure.
But their main focus is maybe lifting the booty or maybe filling in something. When you do the fat transfer, is it necessarily to give volume, or could it also be to just add more fat and shape it out?
So if you're trying to lift the butt, it takes volume to lift the butt. If you think of a balloon, when you're filling up a balloon with air, it doesn't start popping up until it's gotten a lot of air in it. Same thing with the butt. You're really not going to get that lifting effect until you've gotten a good amount of fat in there to start pulling it up, because you need that fat to really bring it up. If you're just trying to fix some dents and a little bit of shape, then you don't need as much volume. So for lifting, you need a lot of volume. For just shaping, depending on what kind of shaping you want, you might not need as much volume.
Nice. We also have a lot of patients that already have really nice projection in the booty, either through a surgery or just naturally. And they always ask if you're able to do just fat transfer to one of the two areas, whether it's the hips or the booty.
Yeah, of course, it's your body. You tell me what you want. When I see you in pre-op, we'll mark the areas that you want to do the transfer to, and that's all I'll do.
How do you work with wish pictures?
Wish pictures are a little bit complicated, so I'm fine looking at them. The thing I take from the wish pictures is I get a better idea of what you're looking for. Because a lot of patients come in and I'll ask them, the main question I ask is, they want to have something that's proportional to their body, or they want to have big. And invariably, if patients tell me proportional and then they say I have a picture, it's always going to be this giant butt. And I'm like, that is not proportional. And so that lets me figure out that what they think is proportional is not proportional. It's actually a very large butt. So that's about the only time that wish pictures really make a difference. Aside from that, I wouldn't say they make much of a difference. I'm happy to look at them, but that's usually the only time it actually helps.
So wish pictures more for realistic expectations, basically.
Yeah, exactly.
Okay. And how do you feel about combining procedures? So a lot of our surgeons do combine procedures, some don't, some combine certain things. How do you feel about combining procedure? What's your favorite type of combination to do?
So the reason that my BBLs have such good results is because I don't like to do certain combinations. When you get a BBL, I want you to stay off the butt and the hips for 3 months. If you do some kind of surgery in the front, a tummy tuck, a breast lift, things like that, well, you can't sleep on those because otherwise you'll have wound breakdowns, your incisions will open up, you'll have bad scarring and all that. You also can't sleep on your back or your sides. So what are you going to do? Sleep standing up? So invariably you sleep on one of those and something breaks down. Some result doesn't come out good. You get flatness on the butt, you get flatness on the hip, or your incisions or your scars on the front turn out bad. And so because of that, I don't want to compromise the result just so you can skip an extra trip, right? Mm-hmm. I'd rather you have the best result. Because then if you have a bad result and then you try to fix it again later, it's not as easy. Doing it right the first time gives you the better result than trying to repair something the second time. It never comes out quite as good because there'll be fibrosis setting in, the skin will have changed, you get scar bands forming in there. It just makes it a lot more difficult to get the right result. I have been talked into doing certain breast augmentations with BBLs, and that's because there is a way for you to kind of sleep on your stomach where you put pillows above and below the breast. But if you go too large on the implants, then I can't do it because then you can't sleep right. So it's up to a certain size. Once you get to a larger size, then I'm not really doing that combo anymore. Again, because I don't want to compromise the results. If you put too much pressure on the large implants, they'll push up. Then you'll have your implants up here. You'll have your breast kind of sagging underneath. It won't look right. Again, you don't want to compromise the result.
All right. And as far as tummy tucks, so we have a lot of questions as to what does a tummy tuck include and what the tummy tuck does to your body. Can you talk to us a little bit about who would be a super good candidate for a tummy tuck procedure and who rather is better with a lipo or a lipo BBL?
Sure. So the whole point of the tummy tuck is to get rid of loose skin, especially loose skin below the belly button, but even loose skin above the belly button. Because what I'm doing is I'm pulling the stomach down tight, cutting off all that extra skin and closing it. And before I do that, I'm also tightening the muscles. Yeah. So if you've had a baby or if you've had a big weight fluctuation, those muscles will be stretched out. And sometimes every workout in the world won't be enough to get those muscles to tighten up. So I actually use a permanent suture to tighten those muscles so that I won't ever pop and open up again. And then I cut out that extra skin. So probably the best candidate for a tummy tuck is someone that doesn't have a lot of fat in their stomach, just has a lot of loose skin and maybe had a kid or two or had a big weight change and just has loose muscles. If you have a lot of fat in your stomach, it's usually better to do liposuction first to get rid of all of that fat. Because when I'm doing a tummy tuck, I cannot do any liposuction above the belly button. Correct. That skin will die and it won't look right. So if you have a lot of fat above the belly button, it's better to do the lipo first, get rid of all that fat. Your skin will become a little bit looser, but then when you come back for the tummy tuck 7 months or more later, I can cut out more skin and make your stomach flatter. And that's usually the best way to do it. Yeah. If you don't have much loose skin, but just have fat and you're young and you don't have any stretch marks, lipo and sometimes with J plasma might be enough to tighten that stomach down and not need a tummy tuck.
And I was just about to ask you that because with all these technologies coming in, a lot of patients are asking and requesting for J plasma. I know there are some surgeons that feel comfortable with J plasma and some other doctors that are more like, how do you feel about J plasma?
Yeah, I think J plasma works pretty well. It definitely requires the right candidate. If you already have your skin kind of folded over and hanging, J plasma is probably not going to fix that. That's going to require skin removal surgery. It's going to need a tummy tuck or a back lift, depending on what we're talking about. But if you just have some extra skin, you don't have a lot of stretch marks, or maybe you have a lot of fat and there's no skin hanging yet, but you're worried that the skin might hang after all that fat's removed, J plasma might be the answer for you. And really, it's something that I need to feel in person. So when I come see you in pre-op, I'll touch your skin. I'll kind of feel the quality of it. That'll give me a better idea. With all of that said, there is a bit of a variable response. Some patients have incredible results from the J plasma. I've even seen patients where I thought the J plasma is not going to work on them. Yeah. They insisted. I did it, and actually it worked out great. And then some patients that I thought would be a great result, and they just didn't have quite the response to it. So I do tell all the patients that it's a little bit variable in the response, but it is the best thing I have to tighten the skin without leaving you a big scar, because it uses the same scars as the liposuction. So that is the benefit of that. And if it doesn't work enough, you can always do skin removal later. But if you do the skin removal first, you can't take that scar away. You're stuck with that scar for life.
Yeah. Talking about, tummy tucks and J-plasma being a possible alternative to a tummy tuck to avoid the scar and things like that. A lot of patients do ask, when you combine procedures, the amount of liters we're able to extract is a little bit different.
That's right.
So what's the science behind it? What's the reason behind that?
I don't really call it science. It's more because there's a lot of non-plastic surgeons doing plastic surgery that don't know how to do safe laws to kind of be like, well, since you aren't going to be a safe surgeon, we're going to force you to do this. It's more for these office-based like we do, but it's mostly because of non-plastic surgeons doing these. You got dermatologists, OB-GYNs, internal medicine doctors doing plastic surgery that never had training in this. But to explain what it is, if you're just doing a liposuction procedure or liposuction fat transfer, which is a BBL, you can do up to 4 liters of fat removal. So it's a little bit more than a gallon of fat, of pure fat. That doesn't include all the fluid and everything. So it's a good amount of fat. And then if you are doing it with a combination, so any kind of cutting procedure, so if you're doing a breast augmentation, tummy tuck, breast lift, any of those, you are limited to just 1 liter of fat, which is not a lot. You think of a little 1 liter Coke bottle. Yep. That's all you're allowed to take. So it is a big difference as to how much fat can be removed when you're doing a combination. So it's also something to keep in mind. If you're coming down, you have a lot of fat, and you're just trying to save a trip by adding in, a breast lift or something else, you might be limited as to how much fat can be taken out, and that could affect your result.
All right. And I think that's one of the main concerns from patients. We have a lot of patients, I get a lot of patients that have previously had tummy tucks with BBLs in the past, whether it was here or somewhere else. And that's one of the biggest complaints, like, I feel like they didn't do anything to my back. And I just feel that it's because they don't know that we're unable, at least in the state of Florida, to do the full 4 liters when you combine, let's say, a tummy tuck with a lipo.
Yeah. So first of all, you're going to compromise your result because you're probably going to be laying on your butt, and you can only do 1 liter. Which is not that much. I mean, my average BBL, I'm putting in around 3 liters. 1 liter is barely going to make a difference, unless you're a very small person. Then 1 liter might matter. Yeah. But if you're a larger person, 1 liter, that'll go through and disappear in your butt in like 2 seconds, and you won't even notice it. And then if you're laying on it, you're killing all that fat. You might have 20% of that fat survive. It's going to look like nothing was done.
Okay. And let's talk a little bit about you, where you come from. A lot of patients do like to know that. It's actually on our website. So tell us a little bit about yourself, doctor.
Sure. So I grew up in Houston, Texas. I did college and med school there. And then following that, I went and did my plastic surgery training in Indiana. I did some additional training in hand surgery in California, but then returned back to my plastic surgery roots, and that's what brought me out here to Florida.
And what made you go into plastic surgery?
So actually, there was a very specific surgery I did when I was in med school that made me want to do plastic surgery. It was more on the reconstructive side. So plastic surgery has 2 sides. There's the cosmetic side, which is mostly what you see here at 305 and New Life and all that. And then there's the reconstructive side. So after cancer, after traumas, car accidents, dog bites, anything like that, that's the reconstructive side. And so I was working at a cancer hospital in Houston, and this patient had avoided doctors for 20, 30 years because she hated them, and she had a skin cancer that ate away most of her neck and shoulder. You could actually see her lungs through the outside. Mm-hmm. And so, her family finally convinced her to come in. We cut the cancer out. And then as the plastic surgeons came, I was on the cancer service at the time. So the plastic surgeons came in afterwards and basically rebuilt this part of her body using her thigh skin and muscles and all that. And when she woke up, next day when we were rounding on her, she had changed her whole mind about doctors because she had this horrible, hideous thing, and she woke up and she had basically a normal-looking neck and shoulder, and she was in love with doctors again. And it really showed me what you can do for someone's quality of life. A lot of medicine focuses on keeping people alive longer. Plastic surgery focuses on making the life that you do have better. And that's what I like the most about it.
Awesome. And as far as medical conditions for patients, that's a huge question. A lot of our patients are diabetic, have hypertension, or certain medical conditions. How do you feel about that? Like, for example, diabetic patients, do you recommend they do liposuction, or do you recommend they do a tummy tuck instead, or it doesn't really matter as far as medical conditions in the case that they're having surgery?
So actually it does make a difference. So diabetes is a great example. With diabetes, the worse your diabetes is controlled, so the higher your hemoglobin A1C, which is a 3-month measure of how well your blood sugar is controlled, the worse that is, the higher likelihood for an infection. and the higher likelihood that your incisions open up. So cases like tummy tuck and breast lift and back lift, the big cutting cases, I have a much lower threshold for your hemoglobin A1C where we can do the surgery, because higher than that, there's a higher risk for complications. For liposuction, I don't really care as much because there's very few things that can go wrong. For BBL, it's higher than cutting cases, but there is still a very specific threshold because you have a high risk for infection. And the fat transfer, the fat that I'm putting in the butt, is like a buffet for bacteria. So if you already have a poor, system for controlling infections because your diabetes isn't well controlled, and then you also add in all of this food for the bacteria, the chance of you getting an infection is very high. So if I have patients that come in and their hemoglobin A1C is way too high for a BBL, I might suggest a lipo, or I might suggest they come back once they have better control for their diabetes.
What would be the ideal A1C for a patient of yours?
Sure. So for cutting cases, I want it to be under 6.2. For BBL, under 7, but the lower the better. And then for lipo, probably under 8 or 9. Once you get higher than that, then you actually have problems with the anesthesia and then being able to tolerate not eating for a few hours and things like that. And we are a freestanding clinic. We're not in a hospital, so we have to be cognizant of that. If there's a complication that we can manage, but if it's something that needs more immediate attention, if there's a complication, that's the kind of stuff that needs to be done in a hospital.
All right. And as far as second round patients for lipo or for lipo BBL, what's the max of rounds? Let's say a patient comes in and she's already had 3 rounds of liposuction. What's like your limit?
I wouldn't say I have a limit. I think I've done maybe 1 or 2 fifth rounds, which is a bit crazy. One of them was actually Suki, I think.
My mom has had 7.
How? Anyway, so that's wild. But I don't really have a limit on rounds. It's if there's actually fat there. So if a patient, like I saw a patient, I think 2 or 3 weeks ago that came in and she'd already had 3 or 4 rounds of lipo and some BBL, some lipos, and there was just no fat in there. And so the problem with that is she might say, well, go ahead and do it. I'm like, okay, but you're going to go through all this pain, all this swelling, and you're going to see 0 difference, right? And then afterwards, you're going to be like, well, you didn't do anything. And even though I might spend 20 minutes telling them there's nothing that's going to change, and then you do the surgery, and they're like, well, nothing changed. I'm like, yeah, it's exactly what I told you was going to happen. So I kind of make my cutoff as to, do I think there's going to be any difference? Is there something I can change? Is there something I can improve? Because, in medicine, the one of our mantras is first do no harm. Surgery does cause harm. And if there's no benefit from it, the risk-benefit analysis doesn't work out, then as a doctor, I need to put my foot down and say, no, this doesn't make sense.
Okay. How many cases do you think you do per year? You're one of our most popular doctors,
per
so.
Year? I don't know. I have to do the math for a second. Let me think about that.
Like a lot.
Probably around 2,000. Let's say 3 a day. Yeah, 3 to 4 to 5 days a week, and then 42, 44 weeks. Yeah, around 2,000, I'd say.
So that our patients mostly come from either out of the city or out of the state.
Absolutely.
For example, first question I want to ask, what patient have you had that has come from the furthest place ever? Do you remember that?
I've had a few from Scandinavia, so like Norway, Sweden, Finland. I've had a few from Africa, actually. Let's see, kind of more central Western Africa. I had a patient from Australia about a month ago. Mm-hmm. That's probably the furthest. Nice. Yeah, that's probably the furthest.
I love that. We had a patient come in to this building from Italy. So they're nice. Coming from everywhere.
Yeah.
Second thing is, patients sometimes do not want to book surgeries because they work, because they have kids. So the time that they have to stay here in Miami is very important to them.
Of course.
So in your case, if you're having a patient come in for a lipo or lipo BBL, what's the recommended stay time?
So lipo I'm not as strict with because, again, there's very few things that can go wrong with lipo. The recovery is a lot more straightforward. But in general, for all the surgeries, I say I want you to stay for at least 5 days after surgery. I'm very strict with that on tummy tucks and breasts. I'm fairly strict with that on BBLs. I'm not very strict with that on lipos.
Okay.
For the breasts, the thing I care the most about is the nipples. The first 5 days are kind of the most crucial. So if anything happens, I need you nearby so we can help you. doesn't happen often. It's very rare, but if you leave too soon and then something happens, it can only do so much when you're not nearby. Same thing with tummy tucks. And the tummy tuck thing is if you fly too soon, your risk of a blood clot goes up. We do give you blood thinners to reduce that risk, but again, we're trying to make sure everything is as safe as possible.
Right.
And then BBLs, we want you nearby to make sure your swelling is going well, everything is healing well before you head out of town. With lipos, there's not much that can go wrong. So I would like you to stay 5 days, but I won't get as upset if you leave sooner.
Okay. Do you use drains for your lipo or only for your tummy tucks?
I do. I use drains for lipos and BBLs. The drain only stays for about 5 days or before you leave town. If a lipo decides to leave town sooner, again, I don't recommend it, but if they do, I'd rather you have the drain removed before you leave town for the lipos and the BBLs. For the tummy tucks, you will go home with the drain unless you stay for 2 or 3 weeks. So I usually recommend patients have someone back home that can remove that for them before they come down.
Okay. Is there anything else you'd like to add on? Anything you'd like to tell patients that are watching you?
Well, so one thing we were talking about before we started this was tanning, because we were talking about tanning.
No, don't put me on the
So
spot.
I won't point out your tans, but I have had to cancel a few patients because we're in sunny Miami. They come down, they go to the beach, they get sunburned. A sunburn is a burn. We might think of it as nothing, but it is a burn. And so when you're doing liposuction or tummy tuck or really anything, you're beating the skin up pretty hard during the surgery. If that skin is already burned, it's now a no-go for surgery. So, if you have a sunburn, I need you to wait at least 2 or 3 weeks for that skin to be fully recovered before we do a surgery. Otherwise, you're really risking a lot of problems, and I'm probably going to cancel your surgery.
Whether it's any type of tanning.
So I don't care as much about spray tan, but the problem with spray tan is that there's a lot of chemicals that can then get into the incisions. I don't really want you to do a spray tan right before you come down, and why would you do a spray tan right before you get surgery? I mean, you probably want to do it after you're healed from the surgery. But the bigger concern is the sunburn, so like a tanning bed or out in the sun, especially if you're going to the beach here in Miami. So if you're going to go to the beach, make sure you're covered up before your surgery and after your surgery. For the first 3 to 4 weeks after surgery is probably the most crucial to avoid the tanning. But ideally, you'd go at least a couple months. And then as for the scarring, you don't want to expose a scar to sun for about 6 months. Otherwise, the scar is going to turn out a lot darker than the surrounding skin.
And we're talking about like the don'ts and spray tanning in specific, but more general idea, what would be your do's and don'ts prior to any type of surgery?
Don't smoke, don't do drugs. That sounds stupid me saying it, but you'd be amazed how many patients we've canceled for positive drug tests, for positive nicotine tests. Again, especially because we're in Miami, people think they want to go party. So don't do that the night before don't do that the week before your surgery, right? You don't want to have any of that in your system before surgery. This is cosmetic elective surgery, meaning you're doing this because you want to look better. Why would you jeopardize that result for a night of fun, right? You're putting an investment in your body, you're putting an investment in yourself. Make that investment count. Don't waste it on something stupid the week before or for the couple of weeks afterwards. So same thing after surgery. Don't smoke, don't be around nicotine, marijuana, all of those things, vapes, cigars, I don't know. Anything that has like a cloud of smoke coming out of you, you don't want to do that for about a month before surgery and 3 months after surgery. And it's amazing how many patients I'll see the day before surgery or a couple of days before surgery, like, oh, smoking's bad for you? I mean, I had this conversation with a patient yesterday. She's like, oh, I didn't know marijuana is smoking. I'm like, all right. The other thing is a lot of patients are trying to gain weight for their BBL. Don't do that with sugar. Do that with protein. Do that with healthy foods. When you do it with sugar, the fat goes underneath the muscle, and I cannot use that for the BBL. It's called visceral fat or internal fat. It'll make your belly look rounder, but it'll be underneath the muscle, so I can't remove that fat. So you'll gain all of this weight, and it'll be fat that I can't use, so it's useless for you. And then after surgery, you want to eat a lot of protein because it helps you heal, it helps the swelling go down faster, just overall gives you a better result. And then stay out of the sun.
All right. Perfect. So thank you, Doc, for being with us here today. I do hope that we are able to do this another time.
Yes.
Patients love you. They ask for you all the time. So I do think we should do this a little bit more often.
Well, thank you so much for having me. It was a pleasure talking to you.
You too.
Thanks.
Bye-bye.
Bye.